Hi, I'm Pat Graham. Welcome to Parent Helpline. Today we're at the March of Dimes with two of their great workers, and I would like to welcome you. We have Janine Lewis, who is the chairman for the Prematurity Campaign for the state of Illinois for the March of Dimes, and a staff member, and Dr. Nestor Ramirez, who is a neonatologist at St. John's Hospital. And this prematurity is a major concern right now. Janine, why has the March of Dimes chosen this as a campaign?
As you may know, we started out working on polio, and we had a huge success with that. We did see that we were able to, Salk was able to find the vaccine that ultimately in 1955 was deemed safe and effective for preventing polio. We then moved on to the folic acid campaign, which we started in '98, and that basically was a health awareness campaign based on really focusing on women of childbearing age, making sure that they were taking 400 micrograms of folic acid daily. And with the formation of the Center for Birth Defects and Developmental Disabilities at CDC, we really felt like we could focus our efforts on another huge obstetric problem today, and we chose prematurity. So when we talk about prematurity, we're talking about babies born more than 3 weeks earlier, less than 37 weeks gestation. This problem has grown. It's grown 27% since 1981. Currently, we're hovering around 1 in 8 babies born too soon, or about 12.1% of all live births are preterm in the U.S. today.
And Dr. Ramirez, you're seeing these 1 in 8 births in your the neonatal intensive care unit where you work. Why is this such a problem? What are you seeing?
Well, one of the main things that prematurity becomes a problem is because babies are being born earlier and earlier because there's advances in the technology, so the obstetricians are able to deliver babies earlier when mothers are very sick or have a lot of complications. And the babies who are earlier, of course, have a lot of more complications. And that becomes a problem not only of the baby himself and of his whole family, because most of these babies end up with some moderate or severe sequela of prematurity and of the treatment that is necessary to give during their premature stay in the NICU. And the other thing is the social cost. The economic and social cost of some of these babies is enormous. And nationwide, we have a huge amount of money being spent on premature babies and on their subsequent care, because they need a lot of intensive follow-up, they need a lot of technology, they need a lot of social interventions. So it's a tremendous problem.
Tell us about the campaign and the resources, and is this like a 5-year campaign or?
Sure. We actually began this campaign just about a year ago in January 2003, so we're celebrating our year anniversary. We will go through 2007. It is a 5-year, $75 million campaign, so that means that the March of Dimes, through our efforts such as Walk America or other special events and other fundraising activities, are really putting $75 million of our own resources into primarily research, but also health education and program services as well.
And when we talk about health education, I think sometimes we don't really understand what prematurity is, what low birth weight and all of that is. Dr. Ramirez, can you explain a little bit about what exactly is prematurity?
Well, prematurity is technically defined as any baby that is delivered before 37 completed weeks of gestation. When you assume that 40 weeks gestation is a full-term gestation, then any time before 37 completed weeks is considered premature. There's also a category in which babies are called low birth weight or extremely low birth weight, and that is based on the actual weight of the baby at birth, but that sometimes does not give you an exact idea of the maturity of the baby. You can have babies who are almost term and very small because maternal smoking, because of different situations, hypertension, etc. So the weight itself was not a good category to define how early the baby was. So now we're talking most about the preterm babies and worry about the length of the gestation as a real big factor in what is going on. The earlier the baby, the more problems the baby is going to have. When you consider that a baby about 27 weeks, 27 to 28 weeks, has only had about 67% of his gestation, it's like somebody were paying you $1 and only giving you 67 cents out of that dollar. So you're being cheated out of those other 33, 34 cents. So this baby has not had all this gestation time and has not had all this time to develop and create all his organs. So he's faced with multiple problems at birth and for a long time after that.
What kind of risk are we seeing? I mean, when I know one of the things the March of Dimes says is, trying to prevent this from happening. And, you know, we tell people to not smoke. We tell people to stop doing drugs. We tell people to stop drinking alcohol, to eat right, to exercise, all of the things that are part of your March of Dimes campaign and of just the basic health care of all doctors. What do you see in the neo-intensive care unit that we just can't even begin to picture?
Well, there's many causes for prematurity, and we don't even really have a single cause for prematurity. We have things that increase the risk of prematurity. We have factors like extremely young age, extremely advanced age. We have factors like hypertension, maternal infection.
And hypertension is high blood pressure.
High blood pressure, yeah. Infection in the mother is a very frequent cause or a very frequently associated factor. Smoking, multiple gestations. Anytime you have more than 2 babies competing for space in the same little tight apartment, then you're going to have a urge to get these babies out. So these babies who are multiples usually come out at premature stages, and it's a very small birth weight also. There are other factors like you mentioned. Smoking is a very important factor. It's a factor that creates a serious problem because some mothers say, well, you know, if I just smoke 1 or 2 cigarettes a day, it's not bad. Or if I just drink 1 drink a day, it's not too bad. There is no safe amount of drinking during pregnancy, and there is no safe amount of smoking during pregnancy. They should be completely 0 in order to decrease the risk of prematurity. Even with mothers who have good prenatal care, who take care of themselves, who have good nutrition, have good health care, take care of their blood sugar and their blood pressure, there are still babies who are born premature. Those are the ones that we don't know exactly what is happening.
And I had one of those, 3-pound, 11-ounce little Sarah, and did everything right. Mm-hmm. So this is what the research, I guess this is like a 2-pronged campaign then. Some of the things that Dr. Ramirez and you've been talking about, the smoking, the drinking, the drugs, you know, we have control over our own bodies, and we can prevent that. So big campaign. But then there's another percentage that just happens. And so that's where the research comes in?
That's where the research is coming in. As Dr. Ramirez said, there's probably about 50% of the cases of prematurity came and mom did everything right, just like you did. So we're really funding a lot of research through initiatives such as our perinatal epidemiological research initiative, which is a mouthful. We call it PERI. And we have 6 researchers, 5 here in the States and 1 in Canada. And they are looking at different aspects. What is going on? For example, one of the big aspects that a couple of researchers are looking on is why are there racial disparities in prematurity? Why are African American moms almost 2 times as likely to have a preterm birth as other races and ethnicities? What role does stress play in preterm birth? Chronic stress, acute stress. How is that playing a role in making that child want to come out a little bit too early? So those are some of the things, and that was funded prior to the actual start of the prematurity campaign, and there was $3.75 million given to those 6 researchers, and we're just trying to fund more researchers so we can find out these half of the causes of prematurity that we have no idea what is going on.
Well, it sounds like the scope of this campaign is very large then. Let's review a little bit exactly, you know, what the mission or goals of the campaign are.
It does sound like a lot, and it's a huge undertaking, but we actually just have 2 goals. One is we have to do our part on the health education and awareness piece. When we did our baseline Gallup poll survey to just see what the general public thought about prematurity, we found that maybe 35% of people thought it was a serious health issue and even worth talking about. So there's a lot of work to be done there and a lot of room for improvement.
So only 1/3 of the people even thought it was a big problem.
1 in 3 thought it was a serious medical issue. So we need to increase that, and we're trying throughout this 5-year campaign to increase that at least to 60% of the general public feeling like prematurity is really worthwhile, and we need to focus some time and some money towards that effort. Secondly, if we've done our job there, then we really want to focus on seeing a lowering in the incidence or the occurrence of preterm birth. So right now we're hovering around 12% nationally. Illinois is actually a little bit higher than that. We're at 12.5%, which ranks us 32nd out of the 50 states in terms of our preterm birth rate.
So there's
31 states
better than we are
that are doing better.
There we go for a goal, right?
Right, exactly. So we want to see that rate, that 12%, go down approximately 15%. So we wanted just around 10% of all live births. And that actually is nowhere near the Healthy People 2010 goal, which is 7.6 of all live births. Although it seems like a few percentage points, we're talking about hundreds of thousands of births, because the latest research shows that about 480,000 births last year were preterm.
So we need a 5.5% decrease in Illinois just to meet, now
Just to meet the national average.
national average.
That's right.
And I'm taking it, Dr. Ramirez, that this is, they're going to be, that's saying they're going to be a certain amount of problems that just happen.
Yeah, there's a
And
certain
it's
amount
probably
of-
going to take us